Welcome to this informative video on the Vasodilator stress test, a cardiac stress test that uses agents like dipyridamole or adenosine to evaluate the function and perfusion of the heart. This test is an important alternative for patients who are unable to perform physical exercise, helping to diagnose coronary artery disease, CAD, and assess other cardiac conditions. Let's begin by understanding how the Vasodilator stress test works. Dipyridamole and adenosine are vasodilators that widen the coronary arteries, increasing blood flow and simulating the effects of exercise on the heart without requiring the patient to engage in physical activity. These drugs induce a state of hyperemia, or increased blood flow, which is key to this test. The test starts with the administration of the vasodilator. Dipyridamole or adenosine is given intravenously over a few minutes, causing the coronary arteries to dilate. In healthy coronary arteries, this vasodilation significantly increases blood flow. However, in arteries with significant stenosis, or narrowing due to atherosclerosis, the response is limited because these arteries are already maximally dilated at rest. This differential response helps identify areas of the heart that are not receiving adequate blood flow. During the test, continuous monitoring of the patient's heart rate, rhythm, and ECG is performed. Imaging techniques like echocardiography or nuclear imaging, such as SPECT or PET, are used to visualize the heart's blood flow and function before, during, and after the administration of the vasodilator. The images taken at rest are compared to those taken during peak vasodilation to identify areas with reduced blood flow, indicating possible coronary artery blockages. If significant side effects occur during the test, aminophylline, a reversal agent, can be administered to counteract the effects of dipyridamole or adenosine. The vasodilator stress test is primarily indicated for the diagnosis of coronary artery disease, especially in patients who cannot undergo exercise stress testing. It is also used for risk stratification in patients with known CAD, assessment of myocardial perfusion, and evaluation of post-revascularization treatments like angioplasty or bypass surgery. However, there are contraindications to consider. The test is not recommended for patients with severe asthma or COPD due to the risk of bronchospasm, severe hypotension, significant heart block without a pacemaker, or those with unstable angina or recent myocardial infarction. Potential complications of the test include flushing and headache, chest pain, hypotension, bronchospasm, and arrhythmias. While these side effects are typically manageable, the test should be performed in a controlled environment with appropriate monitoring. In summary, the vasodilator stress test using dipyridamole or adenosine is a valuable diagnostic tool for evaluating coronary artery disease in patients who are unable to perform exercise-based stress tests. By inducing controlled vasodilation, the test provides crucial insights into myocardial perfusion and cardiac function under stress conditions. Though well tolerated in most patients, careful monitoring is essential due to potential side effects and contraindications. Thank you for watching. If you have concerns about whether this test is appropriate for you, please consult your healthcare provider.